This is Next Strain, which is a real-time tracking of the pathogen evolution. The website is nextstrain.org. You can see the kind of a clade map of the genomic epidemiology here. You can see a picture of the clade map. You go to nextstrain.com. This shows you the map of it spreading around the world as it starts in different places and spreads to other countries. And you're going to see this map is in real time, should be monitored. But we should have it right down to individual communities and individuals, because if everybody's universally tested, they can be tested with little mobile teams and or even remotely tested to see if they have the SARS coronavirus. Then they should get a PCR test, clinical evaluation daily, and even bioresonance monitoring and oximetry, especially people at home that are elderly or have health problems. Those can be done by remote monitoring. Universal biophilia resident testing, PCR, medical history, temperatures, bioresonance, oximetry, mobile and remote. Immediate isolation for positive testing. So in other words, you don't put somebody in quarantine, you immediately isolate them. And if one or more tests, whether it's their history, their body temperature, flu-like symptoms, PCR, or bioresonance, biophilia scan is positive, they go immediately to isolation, not quarantine. First-line defense kit plus a viral suppression of the virus growth, which we have. We've gone over a great detail of that. We'll do that a little later. And prevention of cytokine storm. We have a new product we're adding. For that, we have our Power C Plus and our Cell Defense Plus, curcumin. And we're having a new Cell Defense Curcu Gold powder to mix in drinks. This will stop the virus from causing a cytokine storm or causing organ damage, because it's caused by mitochondrial dysfunction from free radicals and cytokines. Released to quarantine for daily 2-week analysis once all these tests are negative, test monitoring, and once they've had, let's say, at least several weeks of positive tests, they can be released to kind of like a home quarantine, but they should still have test monitored, because you can relapse from this disease. If you look at the history of major infections going back to 1918, 102 years ago, it killed at least 100 million people. My grandmother lost her brother and sister. It was actually an inerrant typhus vaccine. They recombined human and pig flu. They gave the vaccine to people when they went to Spain. That's why they call it the Spanish flu. If we look at the Asian flu, 2 million were dead in 1957. This is at the time before we had a lot of air travel. And the rise of air travel basically around 1960. You see the Hong Kong flu killed 1 million. The Ebola at Congo is still killing people. And there's a new strain of Ebola that's the Marburg strain. It's much more lethal and spreading like crazy, killing local primates. And of course, our hygiene is weakened because of electro pollution from smart grid, 5G network, and toxic demineralization of food and toxic pesticides like Roundup. We have the measles in Congo, 5,000 by November 2019. And we have, of course, this current one, SARS coronavirus. And if you look at the actual genetics of this is a bioweapon released. I believe it's primarily to number one, cull the weak and sick and elderly, and to bring about a new world order and chipping of the population, as well as forced vaccination and tracking of the population. It's a new world order virus I call Virageddon. So let's go look at the next slide here. Democratic senators press Trump administration on funding numbers of coronavirus prevention. Apple says it will not meet with revenue guidance for March quarter. New evidence may impair China's ability to meet trade commitments. World Health Organization officials explain why coronavirus hasn't been called a pandemic. They're trying to hide it, and kind of right now they've actually on a rant trying to prevent it, say that it's not really a problem, or that somehow the West is amplifying it, and they're lying on their statistics. Black Swan event, I consider this a Black Swan event. It's not going to go away. I watch Hannity and the people around Trump trying to pretend this is nothing. This is a disaster for them geopolitically, and I'm trying to get through to Trump, because if I can give him my program, and we've started a very aggressive universal program for monitoring everybody, and immediate isolation of people and quarantine, and viral suppression. The virus can't spread because they're taking viral suppressive therapy like my Nutridyne, Nutrisilver, Allison Med, NutriDefense, Power C Plus, Cell Defense, Curcu Gold, etc., and our suppressive frequencies and other treatments. The virus can't spread because you don't have enough virus, and you can't get sick because you're preventing a cytokine storm. So, which will drain the health resources, because once you saturate the hospitals, you not only have sick health providers, but you'll also saturate them so the case fatality rate will jump from In some places between 1% and 3.5%, 1% in South Korea and 3.5% in places like Italy, it'll jump toward 21%, which is the rate of seriousness of the current L grade and the S grade, which is more serious clade. But it looks like the one from Iran may be much more serious yet, with it looks like a case fatality rate, a multiple of these other ones. China is disinfecting and destroying cash to contain the coronavirus. And of course, China cuts their medium-term rates. All these things are old news going back in February when I did this review. This is not going to be fixed. Now, the SARS coronavirus, let's go over some of these things here. SARS is, we talk about quarantine. I think we should have isolation, then quarantine later as a step down from isolation. We need to have biometric, biophilia, PCR, and clinical monitoring, and of course tracking their FiO2 and oximetry and bioresonance, which can be done remotely. We need to talk about, if you're talking about an RNA vaccine, the problem is vaccines are probably going to amplify the problem if not done correctly. And the virus is going to continue mutating, so vaccine to a current virus now may not even be effective a year from now when the virus has changed its genetics. So you have to understand that current strategy is not going to be very effective. We have to actually prevent the virus from causing mitochondrial failure. That's the primary cause of death. If we want to look at the holographic scan with a bioresonance biophilia scan and PCR test. We need more rapid ones, like a gentleman in Berlin has developed a rapid PCR test that he's spreading them, sending them all over the world. We want isolation first and then movement toward quarantine afterward, and in artificial intelligence monitoring, network to monitor people's GPS coordinates, their names, and their contacts. We want natural host antivirals, which we already have those, and anti-cytokines too, and they're safe. The R0 score basically shows how many people will be infected. The R0 score back in January looks like in China was about 6.7. Once they did full martial law, down to about 2.5 to 3.5. That's not going to stop it. You have to actually get an R0 score down around 1 or 0, or 0. Otherwise, it's going to continue doubling. And the doubling means, for example, back about 2 weeks ago, it was around doubling more, 20% more per day. Roughly now, the doubling time is every 2.5 to 4, and some people say 6 days, but it doesn't matter. It's only a matter of a few weeks difference where it covers millions of people and saturates the healthcare system. So people have to understand that's what the danger is. Case fatality, 16% of cases basically get very sick. New super strains are going to be coming out, like the Qum strain out of Iran. And there may be a substrain also in Italy that may be more serious because there's a much higher case fatality rate, almost 4% compared to 1% in Korea, South Korea. First off, you need to do carrier testing. Before people get symptoms or even get a temperature, it's just monitoring temperatures in the airport or where the thermal scanner is ridiculous. It's not going to, you got to catch people in the pre-symptomatic phase and getting on suppressive therapy so they don't have the virus or spread to other people. You need to have them isolated first, and then you move them to quarantine later. And you also want to make sure you prevent the virus from getting so saturated in the population to get new super strains and mutations occur as the virus adapts to the human population of Earth. Plus, it'll also start spreading to our pets. If it does, you're going to start seeing a lot of pets, like dogs and cats, get affected by this virus as a jump species.